So I wanted to quickly introduce Angeliki. Before we get started, we've been so fortunate to work with her over the years, and she's created some really awesome demo videos with our products. She's a speech and language therapist, myofunctional therapist, and SI therapist all the way from Athens, Greece. And she graduated from City University London in 1996 and trained by the Academy of Orofacial Myofunctional Therapy. She's developed her own method of tongue thrust therapy and really enjoys teaching that in her own seminars. So we're really excited to have her here today, and I'll let you get started.
So hello everyone. Hello Hannah. I am Angeliki here in my clinic in Athens. I work mostly with children and I specialize in apraxia, speech and language delay, and feeding therapy. I'm also a myofunctional therapist, and I have developed my own method on tongue thrust, so I believe I'm quite a tongue expert. And I have also to add that I am married and mother of 5 children, so I had lots of mouths to feed and practice before carrying over to my clinic. Today, I'm very happy to be here to present this webinar on feeding therapy and my favorite Z-Vibe tools that I'm using during my sessions. So when we start our feeding therapy program, our final aim is to get the child to swallow and chew safely. Before, my personal program is a combination of sensory integration and myofunctional therapy. Because in your clinical cases, you will meet children with with oral sensitivity. So here comes the sensory integration, and also weak oral motor skills. So here comes the myofunctional therapy. And in most cases, you will meet both of those two problems. Our final aim in feeding therapy, as we said, is chewing. But in order to get there, we have first to establish 4 basic targets. Oral desensitization, if we have sensory problems, lips, closure and jaw stability, tongue lateralization, and tongue elevation. So for those 4 targets, I'm going to present the exact Z-Vibe tips that I'm using from ARC Therapeutic. So let's start first with oral desensitization. In many cases, you can see that the child doesn't even want them to touch their face, and it's very irritating for them. So I'm not going to start immediately with the Z-Vibe. And we all know what the Z-Vibe is from this excellent presentation we have from Katie a few weeks ago. So we don't have to explain what the Z-Vibe is. So before taking my Z-Vibe tip, I'm going to start first with some gently massage and other techniques without any tools to get used to this massage on the face. And then I'm going to take my tip is the Preefer. I like to start with the Preefer. I don't immediately start with vibration. I first do some massage on the cheeks and the cheeks without vibration. And if I see that this is okay, then I put on the vibration. I always try every new tool I use on the hand, just to the child to have an idea of what's coming on the face. And I explain that it's not going to hurt, it's just tickling, that's funny. And then with the vibration, I don't have the vibration now just to save time and the noise. I start doing this nice massage on the cheeks, 1, 2, 3, 1, 2, 3, around the lips, 1, 2, 3, 1, 2, 3. I usually count up to 3. All right, and towards the ears, and near the mouth. And I'll tell you my little secret. I always massage behind the ears and the neck, because you see that many of children with oral sensitivity, they're scared to go to have a nice haircut. And that's because they're afraid of the machine near the ears here. So always practice the massage and the vibration, especially near this area. And after a month, trust me, they're coming with a very nice haircut. So I like the Preefer. And then I'm going to use, it's nice to have 2 Z-Vibes because it saves time to change the tips. And in some children, you have to be very quick in order to change and move from one activity to the other. Then I like a lot the brass, the soft brass, because I think it's more stimulating. So again, first I try on the hand, and then I'm doing this gently massage on the cheeks. Circle movements and the lips and always the ears. There are so many other Z-Vibe tips that you can also do for massage the face. At this moment, with this, when we do this desensitization, it's very convenient to work together for lip closure and jaw stability. Because I use some similar tips. For example, I'm going to use again the Preefer, and I start with gently massage around the lips. So we did it also before for desensitization. And what I want to do for lip closure is this movement with a vibration, of course, upwards on the lower lip, 1, 2, 3, and hold. And then on the upper lip, 1, 2, 3, and hold. And don't forget the sides, push in the center, 1, 2, 3, and the other side, 1, 2, 3, and repeat. How many times you're going to repeat? It depends on how you work with a child and how the tolerance of each child. I specifically work on the lower lip because I think it's looser. You see, usually a child like this, the tongue rests on the lower lip, so it gets very heavily, and the lips is like this. So I'm trying to elevate the lower lip as much as I can. So the Preefer is very nice to begin with. And then I like very much the white tips. Usually I start with the medium one. Again, I introduce first to the hand, then I use it for some massage on the cheeks. And then I go under the chin, very good for jaw stability. I use it a lot in other exercises too, if I want to work on jaw stability. And then I go to the lower lip. Look how nicely holds the lips together. It's very nice, the white tip. So 1, 2, 3, and hold. Upper lip, sides. And this is the medium one. You can also use the smaller one if its child is very, very young. So I like this. And then I'm going to use the button tools. I love the button tools. Button tips. I'm going to use them a lot later on. I think it's a very good Z-Vibe tip for lip closure. I'm going to use the big one, but if it's too big for your child, you can go a size smaller. There are 4 sizes in the collection. So first, I'm going to introduce on the hand. Then it's very good for some massage. And then I'm going to ask the child to give a kiss to the button. And then very slowly, you have to explain that you want the child to hold it with the lips. Be careful here with your directions because they're going to bite it and we don't want that. So first ask the child to close the teeth and then hold it with the lips. You can do some pull-ups. 1, 2, 3, 4. You can ask the child to hold it tightly. Don't forget to work on the sides of the mouth. You can see some drooling sometimes from one side or the other side, and especially if if there is asymmetry on the face, you have to work more on one side. So always work on the side. 1, 2, 3, hold. I'm doing the same routine. 1, 2, 3 pulls and then hold. And the other side. And then it's nice to take off the tip from the Z vibe because it's very heavy with the Z vibe. And I'm going to ask the child to just hold it up to 10. Close the teeth. And pull. And we can also ask the child to listen to some very strong puffs. It's funny, that one. And they like to hear the puff, puff. A more difficult exercise is to ask the child to move the bottom from one side of the mouth to the other. You can listen this puff up the end. So it's very nice. And you can also then move to the smaller one and even the very, very small one, which is more difficult. So I like to usually to work with a bigger one and one size smaller. Go now to tongue lateralization. Why we need tongue lateralization is because we need the child when learn chew and swallow to take the food from the one side of the cheek or to the other side and learn to eat on the molars and not the front teeth. You have to know that a child with premature pattern of swallowing and chewing and tongue thrust knows only this area of the mouth, the front teeth. It's like this, swallow that like this. So has no awareness of what's going on in the oral cavity. I'm going to start with a Preefer. Remember now that it's the first time that we're going inside the oral cavity. So if there is some sensitivity, we have worked outside with a massage on the face and the massage on the lips and the lip closure, but now we're getting inside. So be prepared that it's not so easy at the beginning. So I'm going to start without the vibration. Gently massage on the cheeks inside the oral cavity. 1, 2, 3 always. And the other side. And then if I see that it's okay from the child, I'm going to add the vibration. So first I'm doing only massage. And then I'm trying to take the tongue and push it on the one side and then the other side. So 3 pushes, 1, 2, 3, and then I'm trying to hold the tongue on the one side. Up to 3 is okay, because I don't want the child to feel any pain. And the other side also. Then I'm going to add this nice tip, the bite and chew extra large textured tip. I like because it has those bumps around and it's very soft. And then I'm doing, I'm doing first introduction on the hand and then nice massage on the cheeks. And then the same movements working on the tongue. It's very nice, it's very stimulating, and it's very soft. So it's very nice, the feeling on the tongue. And at this point, I'm going to introduce the beginning of chewing. I take off the vibration. It's not nice with the vibration. And I ask the child to bite on the one side and then on the other. With the molars and not with the front teeth. Never that. 1, 2, 3, even if can hold it. 1, 2, 3, 1, 2, 3. And then for lateralization, I'm going to use the tongue depressor. I call it spatula. I like in lateralization to work with the texture one because I think it's more stimulating. So again, I introduce and then I do some massage just to understand the place. And then I work basically on the tongue. 1, 2, 3, the other side. 1, 2, 3, and hold it. You see, because it's texture, it gives very nice stimulation on the tongue, and you can hold it easier. So for tongue lateralization, I use the Preefer, the bite and chew fine tip, and the spatula. And let's go now to my fourth target, which is tongue elevation. I will start with the tongue depressor. I will take the smooth spatula now. And now the vibration is very important because it gives even more stimulation to the tongue, stimulation. So I tongue and lift it 3 times upwards, and then hold it upward. Be prepared here to feel a very strong that the tongue is going to be very strong to come out of the mouth if we have tongue thrust. So you have to push. You're going to meet strong resistance from the tongue. Then I'm going to take the bottom tip. I told you that I'm going to use a lot the bottom tip. I like it very, very much for tongue elevation. You see, because it's this square shape, the circle shape, it goes so nicely under the tongue. And you can push the tongue backwards again. 3, and then hold it backwards. See, it's not at all painful. It's very nice to hold the tongue upwards. And I'm also using the bottom tip in order to work on the base of the tongue, the posterior muscles of the tongue. We must never forget that when the tongue is in front and in premature chewing and swallowing, it's only the tip of the tongue that we have to work. We have also to work on the base. A tongue has to learn to go backwards in the mouth. That's why we have to learn to work on the posterior muscles. I take the bottom tip and I push the tongue backwards and hold it backwards. 3 to 5. Why I prefer the bottom tip? It's because I think, and I've seen that with the spatula, this may produce some gagging. So I prefer this. It doesn't go so inside the mouth. This is a very good exercise for speech therapy also. So, and it's very nice also to do it with a smaller one, but I think the big is very, very good. Then I'm going to use my flat spoon. This is a new spoon in our collection, I think. It's the texture one. And I like to introduce this spoon because I'm going later on to use it for giving some thick, solid puree or some solid food. So it's nice the child to get used to this spoon. Okay, at this moment, I think the vibration is all right for the child. So I'm going to use it as a spatula. Try the tongue. Hold the tongue upwards. And it's also nice to use it for lateralization. So it's 2 in 1, spatula and spoon. I think it's a very good thing to have. And finally, I'm going to use my fine tip. I love the fine tip for many exercises. It's not for tongue elevation because it's pointing and it's very painful under the tongue, but it's amazing if you want to pinpoint places to go to tongue to work on tongue coordination. So here, 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 just pointing. But the main reason for that I work with the fine tip is to educate the tongue. Where is the spot? The correct the spot is the correct place that the tongue should push when we swallow, and it's right behind the teeth. It's the palate alveoli, but we're not going to say to the child, put your tongue on your palate alveoli. We're just going to say, put your tongue on these bumps, these lines behind the front teeth, and then try to lick the fine tip. Trust me, if the tongue is not too weak, this vibration gives so good stimulation to the tongue to elevate and touch the spots that we want. If tongue is weak, okay, we've spoke before, we're going to work with the other spatulas and other Z-Vibe tips before getting this nice elevation. I like also to put here some chocolate syrup or some honey or other stuff in order to make the licking more real. So for tongue elevation, I've used the spatula, the fine tip, the button tip, which is my button tip, and the spoon. At this moment, we can also start working on some chewing. I always start with this grabber. It's the soft texture one, because I like the child can also hold it. And I'm going to introduce biting on the molars. Three times, as a child to hold it. And I'm going to try to take it off. You can have some fun games here. Oh, you're so strong. And they feel very secure now that they can bite strongly. And it's very good for their therapy. And I always ask the parents to have their own grabber at home to practice more, and somewhere that the child can, whenever wants, take it. Okay, so the good thing about the ARC Therapeutic Z-Vibe tips is that there are so many that you can use, and this gives us the opportunity to work on the same target, doing the same exercise, but with different tips. And this makes our session more interesting and enjoyable, and not only for us, but also for the child, because what I like to do is have 3 or 4 tips and tools from our collection, and ask the child, which one do you want to start first? And we get the child more involved in the therapy program. At this moment, when we cannot go more deeply on how I introduce solid food, because we need another webinar on that. But I hope that up to now, this presentation was quite helpful and informative for you. So thank you very much, and we can go back to Hannah.
Thank you for that wonderful presentation. We've definitely had some questions come through, so we'll go ahead and take some time for that. There's, I think this question was from Miriam. Do you use all of the button tips in one session, or do you use multiple sizes? So when do you know how to use the different button tip sizes?
Oh yeah, I usually work on all the sizes. And I mean, for example, when I work with, let me show you, when I work with a Y tip, and let's say I want to do it for chewing, because we have this question, the Y tips are also very nice to use it for chewing. I like to explain to them that, okay, let's start with a small one. It's like biting a slice of cheese. Then let's go to the meaty one. It's like, tasting something, a biscuit. It's bigger. And then let's bite the bigger one. It's like biting a piece of meat, just to visualize a little bit the food that in the future we'll eat. With the button tips, I'm doing also the same. I mean, I start with the bigger one, and then I go smaller, just to practice, because the smallest one is more difficult to to hold.
Mhm.
But I like, yeah, I mean, it's to escalate the difficulty.
Yeah. All right. Okay, let's see. And we have a question from, let's see, Sarah. Can all the probes and strategies be used across age groups? So how do you differentiate? So how do you know like which age group to be used for the specific tip?
It depends on the age of the child. Yeah, if it's too small, I mean, you cannot start with a big bottom tip because it's a tiny mouth. But the techniques apply. I use mostly the word child because I work with children in my clinic. But the same techniques you can apply them also for adults, and the size depends on the age of the child and its anatomy. I mean, it's easy to see when you have the child in your clinic. You can just watch the mouth, especially.
Okay. Let's see. All right, and let's see. Darlene is asking, how often should I think I can't remember which protocol that she's asking for, but is once a week therapy session enough? So how often should these techniques be used?
Yeah, that's a very good question. No, in feeding therapy, we need twice per week. If it's tongue thrust only, okay, I mean, it can be with once per week, but for feeding therapy, it takes time to gain the trust, not only from the child, but also from the parents. And I want to say that, I mean, give some extra time in your session to build these relationships with the parents. It's not just a case that comes and goes. And you do feeding, it's different. You have to establish this connection with the child and with the parents. And because at the beginning, if there is sensory problems, the child is going to cry a little bit. It's not going to be easy. So you have first, you as a therapist, to be sure that and explain to the child, to the parent, that you're not going to cause any pain. It's just irritating. So, I mean, don't worry. Okay, it's going to be a bit difficult at the beginning, but it's getting better. It's nice to, in advance, explain that to the parents, that it's not easy at the beginning, but don't worry, I know what I'm doing, and trust. And it needs time, and for sure twice per week.
Yeah. All right, let's see. I think we still have some time. Julie is asking, why do you prefer the textured grabber over the smooth?
Yeah, all the textures one, I think it's more stimulating. So I begin with the texture one because all those bumps, you know, the tongue can go on the bumps and it's stimulating. That's the whole difference.
Okay, let's see here. I think we had someone asking, when you're using the button tips, were you pushing it on the back of the tongue or the surface? If you want to go over, if you can help go over the tongue retraction and with the button tips, the location of where you are placing the button tips.
All right. If I want to work on the base of the tongue and have retraction, yes, I put the bottom tip on the tongue. And then I push the tongue backwards. Under the tongue is when I do elevation.
All right, so maybe we can do something here. Any tips for upper lip muscle exercise? And I think Teresa was asking when the child cannot close the lips on command.
So you have to go back before introducing the bottom tip because it's going to be difficult for that child. Work on the Preefer and work on this movement. And with tapping, of course, but since we're talking about the vibe tips, and I don't know if I have something also, and the bite those bite tubes are also nice. I mean, you can do the same thing, but with different Z-vibe tips, or and also this one, the bite and chew tip is also very nice. I mean, I will basically work more on this movement. And of course, you have to check other things. If we have any problem of allergies or diaphragm of the nose, an open mouth, it's not just loose lips. We have to check why the lips are so loose.
Yeah. So I know a lot of people have been asking about tongue thrust and your development with that. So I think we still have some time if you want to just kind of share a little bit about tongue thrust.
Yeah. What I've seen is that I mean, that we forget to work on the base of the tongue. So this is my first advice to therapists or parents. You have to find exercises that they will work on tongue retraction. Because if we work only on the tip of the tongue, it's half the way. And that's why we have this push all the time of the food, especially outside. I mean, you can see that in Down syndrome, that it's very difficult to have the tongue back inside the oral cavity. So you have to work a lot on this retraction.
Okay. And just a quick question. When would you recommend using vibration and not using vibration?
There are some children that are very hyperactive. They have hypersensitivity. So in those cases, or epilepsy, you have also to be aware if you have this problem. In these cases, you have to be more aware about the vibration. You can work without the vibration. Same Z-vibe tips, same tools, but don't add the vibration. Or just a little bit. Yeah, you have to take the history in your first evaluation and see if there is a problem using a lot of vibration. That's a good question.
Yeah. Well, thank you. So I know it's 10:35 here. So before we
can I also add something, because I thought perhaps somebody would ask. The way I'm sitting with a child when I'm doing feeding therapy, as I don't know, of course, in your country, here in Greece, it's allowed to touch and hold children more. So I don't work with them face to face. I have them on my lap. We are working in front of a big mirror. And it's very important, even for parents at home, to work with a child in front of the mirror in their bathroom, because I want a child to be in front of me and we're working together. We see our faces. We're doing together the same movements. And it's very important for the child to watch the face, their face, when we're doing the therapy.
Yeah, that's amazing. Thank you for sharing that. So before we wrap things up, do you have anything that you wanted to add?
I'm very happy and honored to be invited, and I hope it was a nice presentation. Thank you very, very much.
All right, well, thank you. And we hope that everyone learned something new today. Bye.